Have you ever wondered whether your circulation is quietly declining without any warning? Here's a truth that almost no one tells men over 60. There's a very simple test, only 30 seconds, no equipment that can reveal whether your blood vessels are still healthy or already aging faster than your body. Unfortunately, most men only realize they have poor circulation when the symptoms become obvious: cold feet, numbness, getting tired quickly while walking, or a noticeable drop in male performance. But if you try the test I'm about to show you, you can detect the problem long before it becomes serious. In this video, I'll walk you through 3 essential things. First, how to perform the at-home circulation test used in major hospitals like Mayo Clinic and Cleveland Clinic. Second, how to read your results to know whether your blood vessels are in a safe range or sending early warning signs. And third, the simple daily habits that dramatically improve circulation, so your feet feel warmer, your body feels stronger, and your male health becomes more stable. If you're over 60, this video will help you understand your body in a completely different way. So let's get started, and I promise you, this test may change the way you think about your own health. Before we begin the test, I want you to know exactly who I am and why I care so deeply about circulation in older men. I'm Dr. Emily Carter, a board-certified urologist with 14 years of experience working with thousands of men ages 50 to 85. My work isn't only about the prostate, sexual function, or the bladder. That's what many people assume. The truth is, over 70% of the issues men face after 60, nighttime urination, weakness, low energy, even declining male performance, all come from one root cause: declining circulation, especially in the pelvis and lower body. Over the years, I've seen countless cases where a simple home test helped us detect early problems and spared men from complications that many others unfortunately faced. That's why what I'm about to teach you is not theory. This is the exact test I ask my patients to perform right in my clinic, even before blood work or ultrasounds. It tells us a great deal about the health of the endothelium, circulation strength, and the flexibility of the vascular system. So you can feel completely confident everything I share today is based on real clinical experience, established medical science, and one goal: helping you stay as strong and healthy as possible after 60. Before we go deeper into the test, I want to ask you something simple, but extremely helpful for me. How old are you? And where are you watching from? Texas, California, Florida, or another state? I'm not asking out of curiosity. Knowing your age and location helps me tailor future videos to your lifestyle, climate, and the challenges most common in your age group. Many men over 60 have told me that just leaving a short comment made them feel like they were part of a community, a place where men their age are working to improve circulation, improve health, and stay strong. So if you can, leave a comment below. It helps me a lot, and it helps other men feel less alone in their journey. Now, before you perform the test, there's something important you need to understand. Circulation doesn't decline overnight. It fades slowly, quietly, year after year, especially after 60. When we're young, our blood vessels are flexible, like soft rubber tubes. They expand and contract easily to send blood everywhere. But over time, the vessels become stiffer, less elastic, and the endothelium, the inner lining that produces nitric oxide, becomes less active. When nitric oxide drops, 3 problems happen. First, blood travels to the feet more slowly, making them cold, numb, or easily fatigued. Second, blood flow to the pelvic area weakens, and many men feel they're not as strong as before. Third, recovery after activity takes longer because tissues don't receive enough oxygen and nutrients. What makes this dangerous is that the early symptoms are very subtle. Feeling heavy legs after a short walk, calves feeling tight or cold in the morning, legs going numb faster after sitting, and sometimes slower male response. These may seem minor, but they're early signals of declining circulation. And because these signals are easy to ignore, the 30-second test I'm about to show you will help you see the condition of your blood vessels clearly in a way that's surprisingly accurate. It's not a replacement for medical testing, but it is an early warning system, one that helps you know what to change before it's too late. Now, let's begin with the simplest test, but also one of the most accurate ways to assess your peripheral circulation. This test is called the capillary refill test, and it's used in almost every cardiology, emergency, and geriatric clinic around the world. You don't need any equipment, just your hands, or, if you want even higher accuracy, you can use your toes. Here's how to do it. First, raise one finger to the level of your heart. This is the most accurate position to measure how quickly blood returns. Then, use your thumb on the other hand to press firmly on the fingertip for about 3 seconds. You'll notice the skin turns pale because the blood is temporarily pushed out. When you release, start counting in your head. 1, 2, 3, and watch how long it takes for the natural pink color to return. Your result tells you a lot. If the color returns in under 2 seconds, your capillaries and blood flow are functioning well. If it takes 2 to 3 seconds, your circulation is slowing down, possibly due to reduced elasticity, fluctuating blood pressure, or a weaker endothelium. If it takes more than 3 seconds, that's an important warning sign. It may mean your blood flow is restricted, your vessels are stiffening, or your nitric oxide levels are low. What's remarkable is that this test reflects the health of your vascular endothelium, the area responsible for 80% of your blood vessels' ability to expand and deliver blood efficiently. Many men over 60 are surprised the first time they try this test. But don't worry, what matters is that from today forward, you now know exactly where you stand and can begin improving it. Now, let's move to the second test, called the foot color change test. This test is commonly used by cardiologists and geriatric specialists to evaluate blood flow in the legs, the area where circulation problems usually appear first. You can do this on a chair or bed. Here's how. Sit down, extend your legs in front of you, then lift both legs 30-40 centimeters, about 12 to 16 inches above your heart, and hold this position for about 2 minutes. While holding your legs up, observe the color of your feet. If they stay pink or only lighten slightly, your blood flow is still good. But if your feet turn noticeably pale, whitish, or slightly yellow, that's a sign blood is having difficulty traveling downward when the legs are elevated. After the 2 minutes, lower your feet to the floor and observe how quickly they turn pink again. If the color returns in under 10 seconds, your circulation is in great shape. If it takes 10-30 seconds, your blood flow is slower than ideal, and your endothelium may not be functioning optimally. If it takes more than 30 seconds, that's a meaningful warning. Research from Cleveland Clinic shows that slow color recovery is linked to arterial stiffness, reduced elasticity, or even early signs of peripheral artery disease. PAD. This test is powerful because it shows you exactly how your blood vessels respond to pressure changes, something blood tests alone cannot reveal. If your feet change color slowly, or take a long time to return to normal, don't panic. It doesn't mean you're in immediate danger, but it is a clear reminder that your circulation needs more attention. The next test isn't directly about blood vessels like the first two, but it's one of the strongest predictors of overall health in older men. It's called the grip strength test. Most people think grip strength is only about muscle power, but major studies, including research published in The Lancet, reveal something surprising. The weaker your grip strength, the higher your risk of poor circulation and cardiovascular decline. In other words, your grip is a mirror of your entire vascular and muscular system. Here's how to do it. Grab a small water bottle or any cylindrical object that fits your hand. Squeeze it as hard as you can for about 3 seconds, then release. And pay attention to what your hand tells you. If your grip feels strong, steady, not shaky, and you can maintain pressure easily, your muscles and blood flow are doing well. But if your grip feels weak, fatigues quickly, shakes slightly, or you can't hold the pressure for more than a moment, that's a sign your muscles aren't receiving enough blood, something very common in men over 60 as circulation declines. Many of my patients are shocked by how quickly their grip strength has faded. That's why I encourage all men to perform this test every month to monitor their overall health. And if you feel this segment has helped you, or if any of these tests revealed something new about your body, go ahead and hit the like button so I know you want more deep dive videos like this. Your support gives me the motivation to share even more practical knowledge with men over 60. Before we move into the final part of this video, I want you to know the 4 important warning signs that every man over 60 should pay attention to. These are signs that circulation has already declined to a level where deeper evaluation is recommended, according to the Cleveland Clinic and the American Heart Association. Sign number 1. Calf pain while walking, especially during short distances. If your calves feel tight, hot, or as if they're being pulled when you walk, and the pain disappears when you rest, that's the classic sign of reduced blood flow to the legs. This is not just aging legs. It's a clear signal that blood isn't reaching your lower limbs fast enough. Sign number 2. Cold feet even in warm weather, or after trying to warm them up. Persistent cold feet are one of the earliest indicators of weak peripheral circulation. When blood doesn't carry enough warmth downward, the skin temperature drops. This is not normal, and it shouldn't be ignored. Sign number 3. Toenails or skin turning blue, purple, or greyish yellow. This colour change reflects a lack of oxygen and poor blood supply to the skin and nails. Doctors consider this a red flag, meaning it requires medical evaluation as soon as possible. And sign number 4. A wound on your leg that takes more than 10 days to heal. When circulation weakens, your body struggles to deliver nutrients, immune cells, and oxygen to damaged skin. If a small scrape, cut, or toenail injury heals unusually slowly, that's a very clear message that your blood vessels are not working at their best. If you're experiencing one of these 4 signs, don't panic, but take it as a prompt to get checked. Being proactive helps prevent complications, especially after 60. Now that you've completed the 3 circulation tests, you probably have a clearer picture of how your blood vessels are functioning. And here's the good news. No matter what your results look like, a man's body still has remarkable ability to recover after 60 as long as you give it the right support. I want to share 5 simple, science-backed ways to improve circulation in just a few days to a few weeks. Method number 1. Walk for 7 to 10 minutes a day. Many people think they need long walks, but in reality, just a few minutes a day are enough to trigger the production of nitric oxide, the molecule that allows blood vessels to open and carry oxygen to your tissues. My patients who maintain this habit often notice warmer, lighter legs within a week. Method number 2. Increase natural nitrates in your meals. Your body creates nitric oxide from natural nitrates in food. Beets, spinach, kale, and pomegranate juice all boost circulation. This is why I always encourage men over 60 to add more green and red foods to their daily diet. Method number 3. Practice the 4-6-8 breathing method every night. It's a simple breathing exercise with a powerful effect on the nervous system and blood vessels. Inhale for 4 seconds, hold for 6, exhale for 8. This long exhale relaxes vessel walls, lowers blood pressure, and improves pelvic circulation. Just 3 minutes before bed can help your body unwind and enhance blood flow. Method number 4. Reduce sugar and fried foods. These 2 food groups are the strongest triggers of inflammation in the endothelium. When the lining of your blood vessels becomes inflamed, their ability to expand drops sharply, leading to cold feet, heavy legs, and weaker male performance. Cutting back for just a few weeks can make a big difference. Method number 5. Soak your feet in warm water for 10 minutes before bed. Warm water relaxes peripheral blood vessels, increases blood flow to the feet, and reduces coldness or numbness. Many of my older patients tell me they notice improvement after just a few sessions. The most important thing is this. You don't need to apply all 5 methods at once. Just choose 1 or 2 that feel right for you and be consistent. Your body will tell you the difference. I want to share with you the story of a patient I'll never forget, because his experience reflects exactly what so many men over 60 are going through without even realizing it. His name is George Miller, 68 years old, from Texas. George came to see me with a mix of embarrassment and worry on his face. He said, "Doctor, lately my feet feel cold all the time. I get tired just walking a little. And My male performance seems to have dropped quite a bit. I'm not sure if it's just age or something else. I asked him to sit down, and we began the exact same tests you just did in this video. The capillary refill test, his fingertip color took almost 4 seconds to return. The foot color change test, his feet turned pale when lifted, and took more than 25 seconds to turn pink again once lowered. And his grip strength was significantly weaker than the average man his age. He looked at me with a small, worried smile and asked, "So, is it really bad, doctor?" I told him the same thing I want to tell you. It's not bad. It's simply your body trying to tell you something. It's time to take care of it more seriously. George started applying simple daily habits, walking 10 minutes each morning, eating more greens, cutting down fried foods, practicing the 4-6-8 breathing routine every night, and soaking his feet in warm water before bed. 4 weeks later, he returned for a follow-up. This time, the results were different. His capillary refill time dropped to 2 seconds. His feet regained color twice as fast as before. His grip strength improved noticeably. But what made me happiest was when he said, "Doctor, I feel stronger. I'm sleeping better. And my male performance is much better. I feel like I'm getting back something I thought I had already lost. We can't go back to being 30 again. But we absolutely can regain vitality, strength, and quality of life, simply by understanding our body and caring for it the right way. Through the 3 simple tests and the signs I've shared with you, I believe you now have a much clearer sense of how your circulation is functioning. Circulation isn't something we see with our eyes, but it affects everything. The way we walk, the way we sleep, our daily energy, and even our masculine strength. Just one 30-second test can reveal things you may have never noticed before. And the most important thing is this: circulation can improve whether you're 60, 70, or even 80. A man's body has an incredible ability. When you treat it well, it responds with real, noticeable change. Warmer legs, easier breathing, deeper sleep, and stronger male health. If you found this video helpful, or learned something new about your own body, I'd truly appreciate it if you hit the like button to support the channel and subscribe so you don't miss future videos. Your support gives me the motivation to continue sharing simple, practical, medical knowledge with the men in our community. Over 60. We still have many important topics to explore together, from circulation to prostate health to overall male vitality. Before we finish today's video, I want to leave you with one small piece of advice. If you're focused on improving your circulation, especially after doing the 3 tests in this video, there's one topic you absolutely should watch next. Many men over 60 come to me and ask, "Doctor, besides the tests, is there anything else that can help me improve circulation faster?" The answer is yes. There's one vitamin that acts almost like a switch for your vascular system. When this vitamin is at a healthy level, circulation, especially in your legs and pelvic region, improves significantly within just a few weeks. If you want to understand what this vitamin is, why older men are often deficient, and how to supplement it correctly, watch my video titled "UROLOGIST Reveals the #1 vitamin that restores circulation in older men." This video has helped many of my patients understand it right, fix it right, restoring strength and energy with just one small change in their daily routine. I've placed the link in the description below. Go ahead and watch it next, so you don't miss one of the most important topics for men's health after 60. Before you leave this video, I want to hear something directly from you. Out of the 3 tests we just did, which one took you longer than 3 seconds? You can leave a simple comment like, "Test 1, 4 seconds," or "Test 2, slow foot color return." I read every single comment, and they help me understand the real situation of the men watching this channel. That way, I can give more specific, practical guidance in the next videos. Don't hesitate to share, because many other men your age are experiencing the exact same thing. Your comment might help someone else feel less alone on their journey to better health after 60. Before we conclude, I want to remind you of something important. The tests I showed you today are excellent tools for checking your circulation at home. They can give you early signals and help you stay proactive with your health as you age. However, they do not replace medical evaluation, especially if you experience concerning signs such as calf pain while walking, skin discoloration in the feet, persistent numbness, or unusually slow refill times on any of the tests. If you notice those symptoms, please take the time to see a doctor as soon as possible. Getting checked early brings peace of mind and helps prevent complications that many people never expect. But if your results are normal or just slightly slow, don't worry. Simply follow the habits I shared in this video, and you'll start noticing real improvements week by week. A man's body after 60 still has a remarkable ability to recover, as long as we give it the right care. Thank you for spending your time with me today. I'm Dr. Emily Carter, and I'm here to walk beside you on your journey to staying healthy, strong, and full of vitality after 60. I'll see you in the next video.